I have verified the order and the need for the procedure. I've gathered my supplies, I've performed hand hygiene, I've introduced myself and verified the patient using 2 patient identifiers. I've explained the procedure, provided privacy, and raised the bed to a comfortable working height. I've also placed the bed in semi-Fowler's position. I have a trach kit, a suction kit, 2 pairs of sterile gloves, a pair of clean gloves, normal saline, and a protective drape or water absorbent pad. I've also asked the patient to raise their hand if at any point they cannot tolerate the procedure or they want me to stop. I'm going to place the water absorbent pad over the patient's chest. I'm opening my first pair of sterile gloves. If the patient was on supplemental oxygen, I would hyperoxygenate them prior to suctioning. I'm going to open my suction kit, and when I open my suction kit, I want to look for the little cup that's in there, and I want that to be on top so that when I get it, I don't contaminate any of my other supplies. And when I'm looking at this little cup, I want to make sure I grab it from the bottom so that I don't contaminate the top that I'm going to pour the normal saline in. So when I open it, I just want to be careful not to contaminate the inside or the top of that cup. And you will pour normal saline in there and just move it aside. I'm going to don my first pair of sterile gloves. Once I've donned my first pair of sterile gloves, I can get the suction catheter. I'm going to coil it up in one hand. And I'm going to hold the part that connects to the suction. The hand that now touches the suction is no longer sterile. I am going to attach my suction, and when I turn it on, I'm going to make sure it doesn't exceed 120. And I use my thumb to occlude the airflow, and that's what makes the suction work. I'm going to advance the catheter until I meet resistance or the patient coughs. I'm going to withdraw 1/2 inch, and I'm going to apply intermittent suction by alternating occluding and releasing the airflow using my thumb. If I'm going to go for a second pass, I would rinse my suction catheter and ventilate the client between passes. I'm going to go ahead and discard my suction catheter supplies. I am applying clean gloves, and I'm removing the split gauze from underneath the trach, and I'm going to dispose of that. After I dispose of that, I'm going to perform hand hygiene and get ready for the trach care. I'm opening my trach care kit. In my trach care kit, there's a pair of gloves and a protective drape that I'm not going to use. So after I pour my normal saline, I'm just going to go ahead and dispose of those off the top, using caution not to contaminate any of the other supplies in the kit. So I don't want those gloves, and I didn't want to use that drape because I already have one on my patient, and I'm going to open my sterile gloves. After I've applied my sterile gloves, I can start to organize my supplies inside the trach care kit. I want to moisten the cotton tip applicators. I'm going to fold the pipe cleaners because I'm going to use those to dry the trach later. And they're easier to fold when I can use 2 hands versus 1. I'm going to separate my gauze. I should have 4 pieces of gauze. I'm going to pre-moisten 2. I'm going to put 2 aside for drying. And I'll also have a split gauze in there. So I want my dry gauze on one side and my split gauze with the dry gauze and with the dry pipe cleaners. And I put the pipe cleaners on top because I want to use them first. And then my 2 gauze that I'm going to pre-moisten, I'm going to put on the other side of my trach care kit, using caution not to wet my dry supplies. At this point, I'm going to remove the inner cannula, and now that hand is dirty. So with the I moved my 2 cotton tip applicators. Now I'm going to use the little brush that comes inside the kit, and I'm going to remove any secretions that I see. After that, I'm going to rinse the cannula in the other little basin. And now I can use my pipe cleaners to dry the inner cannula. And I'm going to replace the inner cannula. Then I'm going to use the cotton tip applicators to clean around the stoma. And then the pre-moistened gauze, or the gauze that I moistened, to clean around the stoma. And then my 2 dry gauze, I'm going to use to dry. After I've dried, I'm going to get the pre-split gauze and put it underneath the trach because I want that to protect this patient's skin from any breakdown. If my kit does not have a split gauze, I never want to cut one because the little fibers, if you cut one, could get inside the trach. If I don't have a gauze, I'm going to either fold 2 gauze and put it underneath the trach, or fold 1 gauze, and I can probably show you guys a way when we meet for class how to do that. I never want to reuse the old one, and I never want to cut it, and I never want to leave the trach site without a gauze because I don't want to have that breakdown. So after I've placed the split gauze underneath the trach, I'm going to replace the tie. So before I take off the old tie, I want to ensure that the new tie is in place. I'm going to go ahead and apply the new tie. So once I've secured it to one side, I'm going to apply a slip knot, and I secure it to the side furthest away from me first so that when I'm applying the slip knot, it's closer to me and it's easier to work. After I've replaced a new tracheostomy tie, I'm going to go ahead and remove the old one. And I want to make sure that I put a new one before I take off the old one in case like the patient coughs or something happens. You don't want that trach to fall out. So I went ahead and removed the old tie. I'm going to adjust the split gauze to make everything as comfortable as possible. When I'm done with the procedure, I'm going to discard my supplies, remove my gloves, perform hand hygiene, lower the bed, ensure that the patient is comfortable and that they have their call light. And when I'm done, I'll document the procedure.